Is mental health important? This is a question that most people ask almost every day. Well, my name is Sukeji Modi and welcome to Made to Lead podcast. In this special edition, we will be debunking on this important topic where most people are actually confused. Okay? I want to first inform you about the aspect of worldviews. We have different worldviews when it comes to mental health. Mostly the African worldview almost ignores the significance of mental health. It's seen like something that is Western, something that is not important, something that is for weak people, Like, for example, I remember last week I met a parent who was having a conversation about their son. So I think probably the son is depressed about something. Then he started shouting with the son, "Why are you depressed? Huh? Are you not a man? You're not supposed to be depressed now." That is exactly the perspective and the worldviews that we have. So the first thing is I want you to know that mental health is usually addressed based on our worldviews. But what is the best way to go? The best way to go is by truly understanding whether mental health is important or not, regardless of your worldviews, regardless of your culture, even regardless of your religion. So to begin with, what is mental health? For most people, mental health is about being sound, being okay, like not being mad, in quotes. Because in most cases, people mistake mental health or any form of mental condition to being mad or being insane. But the truth is that mental health is not only about being mad or being insane. And these are the labels that I feel we need to debunk. We need to absolutely remove from our world because it makes us to stereotype mental health condition. As a matter of fact, mental health should be like any other physical disease. So if, for example, somebody has depression, it should be like another person who has malaria. It should not in any way be used to judge a person or to make them feel less of a human. Let me tell you my story. When I finally decided to choose this path of being a psychologist, a mental health practitioner, it was a very interesting one. So when I started telling people about my profession, so when they ask me, "Hi, what are you doing? Or which pathway are we taking?" and I tell people I'm a psychologist, people had different reactions. Some people could tell me, "You've started reading my mind." Other people could say, "You're going to be treating mad people." Other people could be like, "Okay, so that means you'll be treating mad people. We have a lot of mad people, you should come and treat them." Well, these are I feel all these opinions reflect the various misconceptions we have about mental health. And allow me to start this video by emphasizing that mental health is as important as physical health. Because what is mental wellness? Mental wellness is simply your ability to cope with all life stresses and be stable mentally. So as we continue to interact with everyday situations, different challenges, I want you to recognize that as a human being, you're not a robot, you're not a machine. That means you have your emotions intact, you have your cognition, how you think every day, and you have your social networks. All right? So usually when anything interferes with your cognition, with the way you think, for example, if something interferes with how you feel, your emotions, that involves anger, happiness, joy, or if anything interferes with your social environment, it automatically affects your mental health even before your physical health. That's why in areas that have been prone to conflicts, for example, you will meet a lot of people who will show very serious signs of complex trauma. Okay? For example, one of the clearest example I think personally I like using is if you walk into a conflict area. So if you're from South Sudan, you're from DRC, or if you're from any country that has ever experienced war and crisis, there is a way you will always feel about conflict. Your reaction will be different from somebody who has probably never experienced conflict, those who even don't know how a bullet sounds. They have no idea. Sometimes if you tell them that, "Oh, I remember there was war," they keep asking you, "What? Was there war? Was it a real gun?" Yes, it was a real gun. So normally people who come from conflict-driven areas, there is some aggression that comes with it. Yes, people who come from conflict-driven areas or people who have experienced conflict, at least at some point in their life, they can be very aggressive. Now, being aggressive is not an insult, it is a description. This means that an event that happened to you affected how you feel, affected how you think, and affected how you interact with people. That's why mental health is very, very important. And it is important in all aspects of life. As a matter of fact, 80% of all the challenges we see in society today, if we prioritize mental health, we're not likely to face them anymore, right? For example, as an individual, you cannot be stable, you cannot progress in your studies, you cannot progress in your social life, you cannot progress even in having a good relationship with yourself if your mental health is not intact. That's why, for example, in psychology, there are many diagnoses. Sometimes when you walk for therapy or when you go to seek professional assistance, you can be diagnosed with most of these disorders that happen to be there in the DSM-5. But the most important thing is not even going to be diagnosed. The most important thing is recognizing that you're human, you have emotions, you have a mind that deserves to be sound and very, very strong. So let's start by debunking the stereotypes around mental health. Usually, people say men don't cry. People tend to bring in the aspect of gender in the world of mental health. Well, as a matter of fact, depression does not care whether you're female or male. Bipolar disorder does not care if you're female or male. That means mental health naturally should not only be put to a specific gender. So when people start saying, oh, men don't cry, or when people start saying, oh, men don't go for therapy, it's actually a lie. As long as you're a human being, you need that professional assistance. Okay? Because when you go in there, it's not about your gender, it's about you being human. So the first thing about mental health is that recognizing that you are human. So as long as you are human and you're listening to this amazing conversation, your mental health matters. Even how you feel about a situation matters. The reason as to why if somebody offends you, you get angry is because you're human and you have emotions. This means that you're qualified to be mentally, to be physically, and to be spiritually fit. So this is high time we break all the stereotypes around mental health. Another aspect, people take it into the place of this and they think as Africans, no, we cannot suffer from depression. People will be creating a lot of stories around it. Oh, we are strong people. No, as long as you're human, as long as you have flesh and blood, you can actually suffer from all these mental health disorders. As a matter of fact, it has no respect to your origin. It has no respect to your age. You can actually meet a child that is 12 years that is diagnosed with depression. Yes, don't be surprised. As a matter of fact, even if as a person who is 40 or 50, as a senior citizen, you can actually be diagnosed with a mental health disorder. This is because as long as you're human. So I want you, my dear amazing audience, to actually start looking at mental health like the physical health. The same way somebody can be sick with malaria, the same way somebody can get flu, the same way somebody can get cough, is the same way mental health should be normalized, or all the mental health disorders. All right. Another important aspect or stereotype that we should absolutely deal away with is the aspect of, can you guess? Is the aspect of labeling people who have probably were once survivors of mental health or have ever suffered from mental illness. Now, where I come from, in my country, they can actually call them mad people. If they know that they took you to a mental health hospital, they'll be like, this is Mojunun, that's a mad person. This is somebody who's not okay. So even when they come back to society, imagine they are still being labeled that way, which is something very wrong. As a responsible community, we need to make sure that even those who have mental health breakdowns, those who we know were taken to hospitals, we stop labeling them, because it is part of human health. It's just being human. It's about being kind. It's about recognizing that any human being can be prone to any mental health disorder. So today, before I came to record this amazing episode, I was listening to a sermon from the man of God, that's Apostle Grace, and he said something amazing. He said, long time ago, he met a woman who was a survivor of some violence, and then the lady traveled to another country, and where she traveled, she met a man. I think the man married her, and then later the man left her. So after she was left, she became so sick. She had TB, she had HIV, she was constantly in the hospital. She had 2 kids. She could not take care of these children anymore. She left those kids in the house, and then the landlord came and chased these children. So these children became street kids. So he said, When he met this woman and he had this woman's story, he asked himself, what if I was in this woman's place? What could I do? Or what if this thing happens to me? What was I going to do? Now, that is the lens of humanity. So the next time, if you actually see somebody who is depressed, it's not a laughing matter. It's not about judging them. It's about even asking yourself. In fact, you have narrowly escaped, because anyone can be prone to that situation. Anyone can be prone to definitely getting a mental health breakdown. So these are the things we need to embrace. We need to stop judging people, because you don't know what people are going through. People have different life challenges. People have different things that have affected how they look at things. But what should community do? Community should actually become supportive, because sometimes even after your recovery, when we take back clients to reintegrate them to community, to start living with people like every day, you find some people start saying, so-and-so is a mad person, so-and-so was a mad person, so-and-so was this. So these are the things we need to debunk. Mental health is very important, and we should stop stigmatizing people who are survivors or victims of mental health. Because as long as you're human, let me tell you, as long as you're human, at some point in life, you will have to take care of yourself mentally. All right? Another important aspect is the whole story of therapy. Now, usually when we talk about therapy, most people think about you when you go there, it's about exposing yourself. Some people think it's exposing yourself. Some people feel going for therapy is being weak because you cannot solve your issues, But no, therapy is a professional assistance to help you manage you, realize you, and have a better perspective of doing things. So as a human being, personally, I believe that you have a solution to all your challenges. For example, if you're in an abusive relationship and you come for therapy, the therapist will not tell you, leave this partner because the partner is abusive. No, the therapist will discuss with you, will tell you, okay, this is what you're going through, okay? What do you think is causing this? You start telling the therapist, I think it's 1, it's 2, it's 3. So what is the best thing you can do? So therapy helps you to look at things better, and it also guides you to make sound decisions. So therapy does not is not a room for you to be commanded or to be told what to do, but it's professional assistance. Because as a human being, you have the potential to make decisions in every aspect of your life. All right, I hope since we are done with the various stereotypes that we need to break, you start thinking better. You start accepting mental health. The next time there is a mental health camp, you will go, you'll be acceptant. You'll have an open heart to even support those who are even in your family. We live in families where people don't care. Every day you wake up, you eat, people live in routines. But in most cases, the victims or those who are suffering from mental health illnesses, they are not far. They are not far. They're with you in the same homes. They're with you from the same families. They're with you in the same area, but you're just not careful. That's why one day you get surprised that somebody took their life. This means that we have not been listening to each other. You are not there for them when they needed you the most. Okay?